Hello, my name is Lieutenant Alina Doyle. I'm a social work intern assigned to the Department of Behavioral Health at Womack Army Medical Center. Our professional and personal lives have been impacted in a variety of ways recently, and the way we operate in each of these environments has changed. Local businesses have shut down. Mask or other protective gear is required in others. Children are furthering their education through alternative means, and social connection is minimal. The COVID-19 pandemic has been an anxious time period for many people. Healthcare workers are on the front lines of the crisis and are especially vulnerable to these challenges. Not only are they dealing with their own fears of exposures, but they're dealing with their family's angst as well. As behavioral health providers, we hear things such as, "My wife is concerned because I work in the hospital and is scared I'm going to get infected. How do I address this?" Or, "My 5-year-old son is scared because everybody is wearing masks. How do I talk to him about his fears?" It's a tough conversation to explain the professionalism and dedication to duty in the face of a threat like a global health pandemic. You can't watch the news or listen to the radio or scroll through social media without hearing about COVID-19. Like the virus, anxiety can spread like wildfire. Consider the shortage of toilet paper, hand soap, and sanitizer that happened so quickly. To minimize fear and anxiety is to address it before it gets out of control. Here are some things to keep in mind when talking to your family about COVID-19. First, be honest. Start with being open and forthcoming with information. Be upfront and clear. Your family will appreciate that. Being honest and forthright helps calm anxiety. When you circumvent the truth, it only makes people more anxious as their imagination goes wild. Consider the age and developmental level of your family members. Talk to them in a way that they can easily understand and language that they are familiar with. Be calm. Taking the time to speak in a calm tone of voice will help your family hear what you say. They look to your reactions in this situation and they compare their fear to yours. When speaking to them, pay attention to your own demeanor. The way you communicate your message may be as important as the content. Listen and pay attention to the overall body language and tone of the people you see. Be honest and forthright, but also calm and reassuring. This helps when communicating difficult news or processing hard emotions. 3. Be patient. Your family may not have the access to the same information or have the same education you have. The things you know and understand or the challenges that you deal with routinely may be new to them. Take the time to explain information and answer their questions. Keep in mind their level of understanding. Be reassuring. Tell your family the facts about what you and your workplace are doing to ensure your safety. Explain where you work, your possible level of exposure, protective measures being taken, and how your protective equipment actually works. Explain that everything possible is being done to make sure that you and your family are protected from the exposure to the virus. Be factual. Dispel rumors and educate on the facts. If family members repeat misinformation that they have heard, gently correct it. Explain the factual truth in a clear and understandable way. Facts go a long way to dispel fear. Last, be proud. Acknowledge to your family and to yourself that your work during this crisis demonstrates true professionalism. You play an important role at a crucial time in the lives of your patients and your community, selflessly responding to their needs. Be proud of how being a healthcare professional allow your family to share in that pride. Whether you work in healthcare or not, these are not always easy conversations to have. There's not a one-size-fits-all approach, but considering these key points can help guide you. Speaking with children can especially be difficult for parents and caregivers, but I hope that you find this information helpful. Take care, stay safe, and stay strong.